My name is Christina Mortimer, and I completed my policy analysis on the opioid epidemic that is soaring through our nation and claiming lives of many Americans each day. The primary purpose of this analysis is to identify and analyze the opioid epidemic. The specific issues is a substantial number of Americans that lose their life daily due to a drug overdose. The magnitude of the problem varies across states. However, because of the rising trend of addiction and misuse, this has become a national problem. According to preliminary data from the Centers for Disease Control and Prevention, more than 72,000 Americans have died from drug overdose. The goal of this policy is to find an alternative that will be effective to both the private and public interest. There are many stakeholders that are involved with this issue, such as medical health professionals, law enforcement officials, public and private interest groups, state and local officials, family members, and the users themselves. 115 people in the United States die daily as a result of an opioid overdose. Opioids can be used in a safe manner as a pain reliever when they're taken for a short period of time and taken responsibly. Not everyone who is prescribed opioids as pain medication becomes addicted. However, the number that do continues to rise, and our goal is to find a way to bring it back down. In 2017, 11.4 million people misused prescription opioids. Drug overdose is the leading cause of death in America. The importance of the problem is severe and something has to be done. The goal of this policy is to decrease opioid deaths. In an attempt to achieve this goal, alternatives have been developed and analyzed. Alternative 1 is to perform psychological screenings on patients prior to prescribing them pain medication. This alternative could be effective because it can determine any pre-existing mental illnesses that may make a patient high risk for addiction. The efficiency of this alternative is moderate due to the cost of mental health screenings. The equity of this alternative is also moderate because patients who go into a hospital for a procedure may find it unfair that they now need to get a mental health assessment in order to get their medication. The next alternative is for physicians to schedule follow-up appointments with their patients to assess their use of pain medication after their procedure. During these follow-up appointments, doctors may be able to notice any signs or symptoms of abuse. They may ask their patients to bring in their medication with them to determine how many pills are left in the bottles and if they're taking it as prescribed. This alternative can be effective because it will help determine addiction symptoms in the early stages. The last alternative being presented is for physicians to provide education to patients and the patient's loved ones. This alternative will help the family recognize signs and symptoms of addiction in the early stages. Family members typically know normal behavior of their loved ones, so they would be able to recognize any odd behavior and any signs of addiction early on. The problem they may run into is if the patient or even the family member is in denial. After analyzing the three alternatives, it has been determined that alternative A, for physicians to conduct a mental health assessment on patients prior to prescribing opioids for pain relief, would be the most effective in reaching the policy goal of lowering deaths caused by opioids. Assessments will help rule out individuals who have a higher risk of becoming addicted to medication. Also to look for addictive personality traits. Although alternative B would help recognize signs and symptoms, by the time they're recognized, it may be too late. It would be more effective to try to recognize the symptoms in the early stages rather than having to go and help a patient after they're already suffering from addiction. Educating family members and patients could also help recognize signs and symptoms of addiction. However, similar to alternative B, it also might be too late. In closing, alternative A, which is conducting mental health assessments on patients prior to prescribing them opioids for pain relief, will be the most effective alternative in achieving this policy goal. This alternative will help recognize the problem before it even begins. Thank you.